language, education, systemic racism. Today, you'll hear how Wellshare works to address and bridge many of those gaps so that individuals and communities can live healthier lives. First, though, I want to welcome Hani Mohammed Sahreed, who will get us started with a music song. Now I invite you to enjoy your lunch and we'll be back in a few minutes.
Had a different name. We used to be called Minnesota International Health Volunteers, or MIHV. I also wanted to mention Karen Olmos's sister, the late Elizabeth Emerson. She was one of our first volunteer coordinators, and we are indebted to her for her service and are so pleased that her husband, Al Emerson, is with us today. Without visionaries like Karen, Hakan, and Sandra, many women in refugee camps would not have survived childbirth, and many others would have died from preventable diseases. So on behalf of myself, the board of directors, and the entire Wellshare community, I want to thank these founders for their dedication and commitment to Wellshare and the people we serve. As a small token of our appreciation, we have a framed photo of a Ugandan woman whose name is Rukandonda Sisi, who benefited from Wellshare's work. First, I'll ask Sandra Edwardson to come forward. Sandra? served as a long-standing board member, especially in the early years, and her strategic thinking and commitment helped shape the international foundation of Wellshare. She also served in many distinguished positions at the University of Minnesota, including serving as a professor and dean of the nursing school. So please welcome Sandra.
Thank you. Well, I got involved here when our first president, Bill Henry, came to me one day and said, you know, my son's pediatrician, Karen Olness, and her husband have this idea about founding an organization that would bring primary care services to Southeast Asia. Well, that was about all I needed. And the next thing, we were in Bill's living room drawing up the articles of incorporation.
Good afternoon. My name is Samu, and I'm a community health worker at Wellshare International. My job is to work with the Korean refugee community as part of Wellshare partnership with the Korean Organization of Minnesota. Many of you may not be familiar with the Korean. We are an ethnic minority who live in Burma, which is also sometimes called Myanmar. You may have heard on the news recently about Burma because the Rohingya people who live there are now being persecuted. The Korean have been persecuted in Burma for hundreds of years, but especially since World War II. In the 1960s, military forces began burning villages and killing or torturing civilians. This violence and persecution led many Koreans, including my parents, to flee to refugee camps in Thailand. My parents were born in Burma, but my brother and I were born in a refugee camp in Thailand. We are among 20,000 Koreans who now live in Minnesota. After living in refugee camps for a generation or two, the Koreans are learning how to navigate a very different culture. They are learning how to pay bills and adjust to cold, snowy winter. They're learning how to use public transportation to get to work at school. And they're learning how and when to seek medical care. For people who came from simple rural background or live in a refugee camps where they had very few choices in life, the US rather overwhelming and confusing. As a community health worker with Wellshare, I'm helping the Korean understand the US healthcare system. In particular, I'm working with the Korean to help them understand the harms of tobacco and chewing betel nut quid. Betel nut is a stimulant harvested from palm trees that causes cancer. People chew it to freshen their breath after meals, and it's now a common practice. Several days a week, I'm based at the Korean Organization of Minnesota. There, I'm teaching classes to Korean adults who are new to the United States. While you and I know that tobacco can lead to cancer, the Korean have a different experience. The Korean are mostly from rural areas, and when they work in the field, they were always slapping mosquitoes. But unlike in the US, the mosquitoes in Burma and Thailand carry malaria, and smoking cigarettes will help them keep the mosquitoes away. So the Koreans smoke to reduce the risk of catching malaria, and the smoking habit was passed down through the generations. While I'm helping adult newcomers to understand the harms of tobacco, I'm also working with youth so that they don't even pick up a cigarette or begin to chew betel nut quid. We offer a 5-week class after school for Korean youth on why they shouldn't smoke, and they're getting the message. The young people know that smoking is expensive, but more importantly, they're learning that it can kill them. This year, I worked with Korean youth on a Tobacco 21 policy. In June, 40 Korean youth and I attended to the Roseville City Council meeting. We want to advocate for a law that would change the age limit for purchasing tobacco from 18 to 21, even for e-cigarettes. This is a major accomplishment and helped the youth understand the harms of tobacco. But the process also taught the youth how their voice can make a difference in changing health policies. In addition to the adult class and youth work, Wellshare and the Korean Organization of Minnesota created an intergenerational board. Our community is healthier. Thank you for helping the Korean people learn how to be healthier.